Today we are going to discuss how to remove the dark spots from your face in just 4 weeks. Come on, these dark spots again as you wake up in the morning? How many times you start with this question? Are they just popping up from the body and face? They may freeze up without moving away for months. In the worst case scenario, you may apply various creams, lotions that actually worsen dark spots. Keep watching this video. We will unveil secrets behind dark spots and we will provide unique skin solutions that you can practice at home. Let's see why you get dark spots. Dark spots can appear in any age. Some are related to serious health conditions. Melanin is responsible for pigmentation and dark spots. If excess amounts, this is how you would be. Why do dark spots appear on your skin? There are several factors for hyperpigmentation. It may be genetics. Well, thanks, Mom and Dad. If you're pregnant, it's not surprising to see a couple of dark spots. It can be due to hormonal changes, like Addison's disease, where patients get low blood pressure. Low blood sugar with increased pigmentation. Dark spots can be alarm bells of liver disease. There are a lengthy list of diseases which can cause increased pigmentation and dark spots. How we are dealing with dark spots following naked eye visible skin insult with superficial light brown to dark spots. Let's see how. We are clearing dark spots. Step 1. Moisturizers and sunscreen. Moisturizer and sunscreen enough to clear 90% of dark spots. Watch for 3 months. It will vanish completely in 90% with sunscreen and moisturizers. Use a moisturizer which is not a pimple promoter. Labeled as non-comedogenic are the best.
If you're really into skin lightening, is to use something at either zinc oxide or titanium dioxide base, so that gives you better protection from UV. Be in also long-wave UVA. So that's very important. Something is a first thing you do. Okay, so what else can you do to lighten your skin? Well, a simple thing is glycolic acid. Glycolic acids come in different strengths. Apply once a night. If you tolerate it, can use in daytime together with sunscreen. This will give you lighter skin. If you want to step up, there are other things we can do. You can start off with vitamin A like retinol, can also help with skin pigmentation, especially epidermal skin pigmentation. It can also reduce the amount of melanin transfer. So in other words, amount of pigment transferred to your cells, but at the same time it increases the turnover of your skin. So what else can we do? We can use a vitamin C. Vitamin C works as an antioxidant. It's an antioxidant, and antioxidants scavenge free radicals, so certainly from UV lights, environmental stress, free radical scavenger, and it's best to use it during the day, because that's where you get your UV. It suppresses melanin formation in melanocytes. You can have some fresh fruits or vitamin C tablets as you wish. Niacinamide is a water-soluble B vitamin, and it is essential coenzyme that play a role in over 200 different types of reactions in our body. It's very well tolerated, appears to be safe and applied topically on the skin, with no reported serious adverse consequences. It improves dry skin eczema on the face, dark spots, and as well as acne and oiliness and shininess. When it comes to dark skin, niacinamide, it inhibits melanosome taster from melanocytes leading to lighter skin due to lack of melanin. Kojic acid, targeting brightening and hyperpigmentation, but it also is an antioxidant. It can help in scavenging the free radicals. Kojic acid also inhibits tyrosine enzyme, which is essential for melanin synthesis. Kojic acid can help to lessen some of the damage to the skin from ultraviolet radiation exposure as well. You can really get some decent sustained benefit. Kojic acid applied to your skin in a topical preparation like a cream is incredibly safe with low to no detectable levels in the body after application. Alpha-arbutin is actually a naturally derived antioxidant that comes from either bearberries, blueberries, or cranberries. Arbutin is inhibiting tyrosine activity and melanin production. It's actually just a slowing down of melanin production process. You don't have much side effects or irritation. What else can you do? Well, there is something called hydroquinone. You can buy over the counter. There's something like Superfade, so Superfade can actually help with skin pigmentation. Hydroquinone bleaches your skin by decreasing the number of melanocytes, eventually leading to lighter skin, vanishing your dark spots. Although hydroquinone is generally well tolerated, there are a few exceptions. If you have a medium to dark skin tone, talk with your dermatologist before applying hydroquinone. Hydroquinone may actually worsen hyperpigmentation in darker skin tones, rarely. If you want to take it a step further, yes, there is a trend nowadays to use intravenous glutathione. Can actually work, and that works together with intravenous vitamin C. In both of them work together as free radical scavengers. So basically, that's how they work. They actually absorb your free radicals and reduce melanin production. Usually, you go for weekly IV infusions. For every 4 weeks after that, you can back it off to once every 3 weeks or so. It lacks clinical data, so usage is controversial. Still, many are undergoing this process worldwide, as it gives rapid response.
Salicylic acid belongs to the beta-hydroxy acid family of acids. Great for zapping oil on the skin. When used as a peel, this type of acid is good for those who have pimples and acne. Because of its beneficial effects, salicylic acid is often used by dermatologists to treat skin concerns like acne, melasma, freckles, sunspots. Let's see how to do it.
Salicylic acid is an over-the-counter medication that gives marvelous results for pigmentation and superficial scars. It is a keratolinic. It encourages cell turnover and helps to exfoliate the skin. Salicylic acid does superficial peeling of the skin. Start with 20% and moving up slowly to 30%. You can apply salicylic acid twice weekly. If you feel dry or irritation, you can add some moisturizers. It will soothe you. Let's see how to apply 30% salicylic acid. Start from right side of the forehead to the left side of the forehead, left cheek, chins, finally right cheek. You can apply 2 times if you are not uncomfortable. Avoid touching sensitive areas around eyes and lips, also areas already having red inflamed pimples. Upon evaporation of acid pseudofrost formed in skin, left it for 5 minutes. It can be removed from the skin with a face wash or wet cloth. For edema, redness irritation, gently touch with ice packs. It will reduce in few hours, skin peels in 2 days, leaving regeneration of new skin. For swelling and mild discomfort, ice pack can be used following the application of white petroleum for the next 3 days. Can switch to emollients as routine after the first 3 days. Please remember to wear sunscreen. It will avoid sun damage and skin redness.
TCA peels are cosmetic treatments that use trichloroacetic acid, TCA, to improve your skin's appearance. A TCA peel is a non-invasive skin treatment used to treat skin discolorations, scarring, and wrinkles. These peels get their name from trichloroacetic acid, TCA, which is used to clear away dead skin cells to reveal the newer and smoother skin layers below. Let's see how to do it.
Start from right side of the forehead to the left side of the forehead, left cheek, chins, finally right cheek. You can apply 2 times if you are not uncomfortable. Avoid touching sensitive areas around eyes and lips, also areas already having red inflamed pimples. Upon evaporation of acid pseudofrost formed in skin, left it for 5 minutes. It can be removed from the skin with a face wash or wet cloth. For edema, redness irritation, gently touch with ice packs. It will reduce in few hours, skin peels in 2 days, leaving regeneration of new skin. For swelling and mild discomfort, ice pack can be used following the application of white petroleum for the next 3 days. Can switch to emollients as routine after the first 3 days. Please remember to wear sunscreen. It will avoid sun damage and skin redness.
Ordinary peeling solution, 30 ml, AHA 30% and BHA 2%. AHA, or alpha-hydroxyl acids, are acid like glycolic acid and lactic acid, which really work to dissolve the dead skins off of the face. In addition, tyrosinase enzyme also inhibited to a less degree, which ultimately responsible for melanin formation and skin pigmentation. In addition, this also has BHA or salicylic acid. Salicylic acid is another exfoliating ingredient. It goes deep into the pores and pushes out any excess sebum or oil production, making it the perfect ingredient for someone with more acne-prone or oily skin. This can be used for acne scars and pigmentation, reduce post-inflammatory skin pigmentations and dark spots. This is formulated with 30% ash and is powerful stuff, and you don't want to misuse before you ever put this on your face. You want to do a patch test if you are more prone to allergies. Chemical exfoliators can burn. They can cause pigmentation and irritation redness. You can use the dropper to apply this acid directly to the skin. You can drop this onto fingertips and then swipe it on, or you can drop this onto a cotton pad and apply it to the skin. It's better always start with the more resilient areas of the face first: cheeks, chin and jaw, then move over to the hairline and sides at the head, as well as the forehead. Do the top of the nose and the delicate skin that's close to the eye area with cautious. This product should never be put in the eyes or in, and this delicate under eye area, if you're worried about messing up, you should put Vaseline around the eyes and the lips to protect them. Leave this on for 10 minutes and then rinse off, and do not leave it on any longer. For most, this doesn't even burn and barely feel it on the skin, but for others, it might have a warm or slightly tingling sensation. After you've finished rinsing with cold water, with acid neutralizer or a pH-balanced cleanser, if there are any chemical acid pieces left over, these could balance them out and make sure that they are no longer active on your face. If you get redness irritation, gently touch with ice packs. It will reduce in a few hours. You can go in with a moisturizer to hydrate the skin. Better to avoid using comedogenic agents, retinols, salicylic acid for the next 5 to 7 days. It is mandatory that you use a sunscreen. We've removed the outer layer of our skin, the stratum corneum. The sun could do a lot more damage than it normally does, so you need to wear a sunscreen with good SPF protection.
Hyaluronic acid cream is something good that you can try. Hyaluronic acid can glom onto that water and really help enhance hydration in your skin. Most of the skin treatments do not give permanent results. It is extremely essential to be patient and take maintenance sessions while taking any skin treatment, especially when taking skin lightening treatment. Even better results are achieved when a combination of treatments is taken. Apply sunscreen, eat healthy food, avoid junk food, avoid smoking, avoid too much of alcohol intake, and do some exercise every day, and sleep well. You will definitely get healthy glowing skin.